thought that was it. I really thought we were going to lose him that time.
It felt like something had been ripped from the inside of my chest.
Let it be me, not my child.
I started to think, can I raise our son by myself?
Jack cut his first teeth. They were pointed.
It's not possible that there's not somebody out there who can help us.
Next, 3 medical mysteries that defy the experts. Little Jack Heglin is on the brink of death, suffering from malnutrition and strange infections. But his doctors can't find anything wrong, with the exception of a possible milk allergy.
I knew there was something else. Deep down, I knew there was something else.
Brian Sloan is an active, athletic father of 4 until mysterious pains in his chest and extremities leave him crippled and desperate.
I can picture him holding his head in his hands and saying, I can't go on like this.
And Montessa Pitman hasn't been sick a day in her life. Then, within a matter of months, she's in the hospital, fighting for every breath.
I was an invalid, just that fast.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. September 2002, Roy and Charlotte Heglin welcome their second child into the world, a baby boy named Jack.
Everything about him, his hands, his feet, everything was so perfect. We unwrapped him and then wrapped him up again.
Basically, everything was full steam ahead. He was eating well. He looked like a normal, healthy baby.
But 2 weeks later, things begin to change.
He started spitting up. Then we also noticed that his bowel movements started to become loose.
He was looking very pale, not looking well, but it happens occasionally. Nothing to be alarmed about.
The Heglins never experienced these problems with Jack's older sister, Christina, so they decide to take him to their pediatrician.
I thought that he might have had gastroesophageal reflux, so we thickened his feedings and sent him home.
Jack was okay for about a day or so. And then the spitting up started to become a little bit more than spitting up. And the diarrhea started to become a little bit more frequent.
8, 9, up to 10 diapers in a day. I mean, it's been as high as 30 diapers in a day.
For the next 3 weeks, Roy and Charlotte are on the phone with Dr. Levy every day, trying to find the right formula for Jack. But nothing seems to work, and Jack is losing weight rapidly. Terrified, they bring him back to Dr. Levy.
When I saw Jack at 5 weeks, I was horrified at how his condition had deteriorated.
He said he is severely dehydrated. He had lost 2 pounds and said he needs to get fluid immediately.
The Heglins race to the emergency room, where the doctors tell them that 5-week-old Jack is literally starving to death.
The medical term was he was in malnutrition dehydration because he was not taking anything in.
You just think, oh my gosh, what did I do? Did I do something wrong? Should I have brought him to the doctor sooner?
Dr. Levy said, I don't know what's wrong with Jack. He needs to be put into the intensive care unit.
Jack is immediately admitted and put through a battery of tests, but doctors can't find anything wrong. Just as a precaution, they start him on a course of antibiotics. After 2 days, Jack still can't keep his formula down and appears to be barely hanging on. Doctors speculate that it could be an allergy to milk protein and put him on a milk-free formula. 10 days pass, and Jack appears to stabilize. Then, a bizarre new symptom begins to develop.
His right foot started to swell. And they just monitored it. However, the swelling started to become a little bit more prevalent. It went into his whole right leg, then it went into his left leg.
That eventually just stayed in both legs, and his legs came to look like tree trunks.
The doctors think the swelling is somehow related to Jack's other symptoms, but they don't know how. 2-month-old Jack is put on steroids in an effort to reduce the inflammation. It helps a little, but his legs remain noticeably swollen.
This was something beyond normal, beyond any stories that I had heard.
But for Charlotte, this is all too familiar. 39 years earlier, her twin brother died after displaying bizarre symptoms just like Jack's. Then, 13 years later, her sister's son succumbed to a mysterious illness, again with similar symptoms. Now the same killer seems to be attacking Jack.
Jack's symptoms certainly coincided with that family history, but we could not come up with a true diagnosis for them.
It scared me. It scared me. I prayed that I wouldn't have to go through what my parents had gone through, what my sister had gone through.
After 2 months in the hospital on his new milk-free diet, Jack finally seems to be stabilizing, so the doctors send him home.
I was hoping that it was done with, like, okay, we dodged this bullet, we found out what was wrong, we're moving forward here, and, you know, we'll go on to being normal.
But Jack is only home for 2 weeks when it starts all over again. He can't stop vomiting and suddenly spikes a 104-degree fever. Charlotte rushes him back to the hospital.
They found out that he had H. flu bacteremia. Again, this far-out thing that I had never heard of.
The doctors immediately put Jack on intravenous antibiotics to get rid of the H. flu, a common bacterial infection. After a couple of days, he begins to get better. But as the months pass, the cycle continues. Jack is spending more time in the hospital than he is at home, constantly on the brink of starvation or fighting infections, and no one can figure out why.
We saw gastrointestinal, immunology, allergy, pulmonologist, cardiologist, a rheumatologist. Every specialist there is, we have.
Nobody was giving me a solid diagnosis other than a milk protein allergy. And milk protein allergies don't cause infections.
I knew there was something else. Deep down, I knew there was something else.
Then, as Jack approaches his first birthday, when Roy and Charlotte think there simply can't be any more surprises left, Jack manifests his most bizarre symptom yet.
Jack cut his first teeth, and they were both pointed.
Toothpick point teeth.
They were like fangs, really.
The Heglins are horrified and scared for their son.
We were afraid he was going to hurt himself, so we took him to the pediatric dentist.
The dentist believes there's a reasonable explanation for the strange teeth.
The dentist felt that this just could be a result of all the medication that Jack was on.
He files them down and tells Charlotte that it will be easier to take x-rays when Jack is older. But Charlotte is overcome with dread. She remembers that her nephew had cut a few teeth before he died, and they were pointed, just like Jack's.
The worst fear was that they were going to lose another little boy in their family.
I wanted Jack to be different. I wanted his case to be curable, and I didn't want Jack to seem like he was doomed.
Two-year-old Jack Heglin was born with symptoms eerily similar to a mysterious disease that killed 2 other baby boys on his mother's side of the family. He's been in and out of the hospital for the past year. Roy and Charlotte Heglin now feel like they're in a race against time to save their son's life.
I searched high and low on the internet. I would stay up till 1, 2, 3 o'clock in the morning reading more medical articles than I ever thought I would read in my life.
We were sending him to the top specialists, not only in New Jersey, but all over the United States.
Then, in October of 2004, the Heglins are referred to a top children's hospital in Ohio for a full workup. There they meet with Jack's new gastroenterologist, who sets up a series of tests with a team of specialists.
The following morning, a dental resident came in to the hospital room. And he kind of looked at Jack. He looked at Jack's teeth, looked at Jack's hair, and he says, "I think he has ectodermal dysplasia."
And I said, "What?" He said, "Yeah, this is a rare genetic disorder that affects the hair, the teeth, the nails, the skin, and the sweat glands." And he said, "Does your son sweat?" I said, "No, he doesn't."
But ectodermal dysplasia does not explain Jack's most serious symptom, his digestive problems. And after 4 days of testing, the gastroenterologist has no explanation either.
He said, I just want you to see another doctor before you leave. And we stayed to see this allergist immunologist.
The immunologist reads Jack's charts and performs a thorough exam. Then she tells them something they're completely unprepared for.
She thought that Jack might have this rare primary immune deficiency that went along with ectodermal dysplasia.
And she said, well, I want to run some testing. She ordered some more blood work, and she said it would take several weeks before we would get those results.
Unsure what to think, the Heglins take 2-year-old Jack back home and wait for the call from Cincinnati. But before the results are back, Jack suddenly spikes a fever and refuses to eat. Charlotte and Roy rush him to their local ER, where the doctor orders a chest X-ray.
He said, it looks like he could have pneumonia.
When they tell the ER doctor Jack's history, he immediately tracks down the immunologist in Cincinnati.
She said, Jack needs to go down to Children's Hospital of Philadelphia now. There's a doctor down there, Dr. Orange, who knows all about this immunodeficiency that Jack may have, and he needs to get down there because the pneumonia could be life-threatening.
So 2-year-old Jack is put into an ambulance and rushed to the Children's Hospital of Philadelphia.
It was so similar to my nephew. I thought that was it. I really thought we were going to lose him that time.
Jack's in the ambulance, Charlotte's in the ambulance, I'm falling behind, and I'm crying my eyes out. Hey, look, if this is it for Jack, do it quick.
When they arrive, Jack is admitted to the pediatric intensive care unit, where he is examined by Dr. Jordan Orange.
When I first saw Jack, of course, he was quite ill. He was skinny, he was breathing heavily. So first, we treated his pneumonia, we treated his infections, and we tried to nurse him back to health.
Dr. Orange is also consulting with Jack's immunologist in Cincinnati, and he agrees that all of Jack's symptoms could be due to a disorder that weakens the body's natural immune system.
He really felt that Jack had this rare genetic disorder called Nemo.
I was like, Nemo? I said, that's a fish.
Nemo is not a fish, but it's a gene. And it's a gene that makes a very important protein in a cell called the NF-kappa B essential modulator. What that does, it's a master switch inside of cells. You need to be able to turn this switch on when you need these cells to do something like fight an infection. And you need to be able to turn these cells off when you don't want them to do something like attack your own body.
The Nemo gene is found in almost all human cells. In someone with Nemo deficiency disorder, the gene is defective, causing a communication breakdown between the cell nucleus and membrane. Without clear instructions from the nucleus, cells cannot function properly. This leads to massive organ and system malfunction. The disease only strikes boys, passing from mothers to sons on the X chromosome. Left untreated, Nemo deficiency is deadly.
Ultimately, the only way to confirm the diagnosis that I suspected was to do a genetic test of Jack's DNA.
3 weeks later, the test confirms what Dr. Orange already suspects. Jack has Nemo deficiency disorder.
So the mutation in Jack's Nemo gene results in a great number of problems. One is that their immune systems don't work. Part of Jack's severe diarrhea and an inability to tolerate food, essentially, was caused by one of these unusual mycobacterial infections that had set up shop in his gut and was actually wreaking havoc there. Another problem is ectodermal dysplasia. Children who have this don't sweat appropriately. They can get really high fevers, and they can even die from these fevers.
In other words, Jack's bout with pneumonia could have been his last.
But if we had not made the diagnosis, it was very likely that Jack was going to die, and that Jack was going to die relatively soon.
Jack is started immediately on intravenous immunoglobulin therapy, also known as IVIG. These are antibodies derived from donor blood, and they give Jack the ability to fight infection.
There was an immediate change after Jack started his IVIGs. He was just a healthier Jack.
After a few months of IVIG and antibiotic therapy, Jack improved significantly.
He went from having hospital stay to hospital stay to hospital stay to almost having no hospital stays.
Once Jack is out of danger, Dr. Orange decides to test other members of his family. He discovers that Charlotte is a carrier of the mutated gene, as are her mother and sister. And after all these years, he finally solves the mystery of what killed Charlotte's twin brother and her nephew. It was nemodeficiency disorder.
It made me feel very guilty that it came from my side of the family, but it was a breath of fresh air, knowing that we finally have an answer.
Roy and Charlotte are astonished to find out how close they came to not getting an answer at all.
Nemodeficiency was impossible to diagnose because it was unknown, and it was only in late 2000 that it actually entered the medical literature.
Today, 1 year after his diagnosis, Jack is a rambunctious 3-year-old. But he isn't completely cured. Nemo is a very serious condition.
Jack's IVIG therapy does plug some of the holes that nemodeficiency creates in his immune system, but it doesn't plug all of the holes. Any infection that Jack gets could be his last.
The next step is stem cell transplant therapy, where cells from donated bone marrow are transplanted directly into Jack's body. If it succeeds, it will give him a healthy new immune system. The procedure is scheduled to take place shortly before his 4th birthday.
He's a strong-willed kid like I've never seen before in my life. And that's the best part about Jack, because of his fight and his drive. I think that's what's going to put him over with the stem cell, too.
We'd like to try and give Jack life, and a stem cell transplant could give Jack the life that the other boys didn't have.
Doctors eventually traced Jack Heglin's condition all the way back to his DNA. But when Brian Sloan started to feel shooting pains in his back and neck, he never dreamed where they would lead.
And the pain that I had in my neck was a sharp pain when I would turn my head, but the pain between my shoulder blade and my spine, certain activities, throwing a ball, doing exercises like push-ups and things like that, really aggravated that area.
I just figured it was from being active and being involved in a stressful job.
Brian chalks it up to years of wear and tear from playing sports. He gradually learns to live with what he assumes are just the aches and pains of getting older. Then, 5 years later, a new and seemingly unrelated symptom appears.
I would feel a burning sensation in my chest, like a tugging or a pulling sensation in my esophagus when food would pass.
Brian goes to see his family doctor, and she orders an endoscopy, a procedure in which a tiny camera is inserted down the throat and into the esophagus.
They said it looked to have a little bit of esophagitis, which is a slight erosion of the esophagus.
Esophagitis is often caused by acid reflux, in which acid from the stomach backs up into the esophagus and irritates the lining. The doctor prescribes some antacid drugs, but the pain in Brian's esophagus keeps getting worse.
And when I would talk, my chest would vibrate and have a sensation that would cause me to want to cough. My chest felt like a golf ball was wedged up between my esophagus and my windpipe.
Assuming it's more fallout from the esophagitis, Brian tries experimenting with a healthier diet, but it doesn't help. One day, the pain is so severe that he thinks he's having a heart attack and rushes to the emergency room.
EKGs turned out normal. All of the heart tests turned out normal. Blood work turned out normal.
I started wondering, have they missed something totally? Like, do I have tumors growing in my chest or something like that? And they're not going to find out till it's just too late.
For the past 5 years, 37-year-old Brian Sloan has been racked with paralyzing pain in his back and neck that no one can diagnose. He is beginning to think he'll have to live with it forever when an alarming new symptom strikes.
I would reach out to operate the computer with my right arm forward, and I would feel my hand going numb.
It was difficult for him to grasp things or pick things up.
This sudden muscle weakness worries Brian and his primary care doctor, who immediately refers him to a neurologist, Dr. Rabindra Kitchener.
Surprisingly, I couldn't find much on the examination, so that's when we proceeded to do a procedure called an electromyogram. It's a test that's done to check for nerve damage and muscle damage, and these studies came back as being normal. Then that's when we got an MRI of the brain and his neck and his back. These studies were also normal.
Kitchener administers test after test, but nothing shows up. He eventually prescribes pain relievers, which help enough for Brian to get by.
It was a strange pain because it would come and go. I thought maybe that something just can't be answered.
Then, 1 year later at a company baseball game, what had been just aches and pains suddenly turned into something much scarier.
I hit the ball. When I got to third base, I really had to make an effort to get in as much air as I could.
He came home and was holding his chest.
It felt like something had been ripped from the inside of my chest.
They quickly grab Brian's medical files and head back to the ER.
They checked him out as far as an EKG and a chest x-ray.
I asked him if he thought it was a heart attack because the pains were so severe.
But again, the tests all come back negative. Nothing appears to be wrong with Brian. The doctor prescribes more pain medication and tells him there's nothing more he can do. Brian is crushed. He tries to go on with his normal life, but he knows that won't last for long.
I kept wondering, at what point am I not going to be able to pretend everything's okay?
I can picture him sitting at the kitchen table with his head down and holding his head in his hands and saying, I can't go on like this. And I know there were times he felt like giving up.
I knew at some point, at this rate that it was progressing, I would be forced to stop.
Then, in August of 2004, 8 years since all of this started, yet another bizarre symptom begins to surface.
I began having muscle twitches in all different muscle groups in my body. You could actually see the muscles jumping on my legs, on my arms, and they began to move into my face and into my eyelid.
Completely distraught, Brian returns to the neurologist he saw the year before. Dr. Kitchener is extremely interested in the new symptom Brian describes.
He said that every time he coughed or sneezed, he would get lightheaded and his right eye would begin to droop and twitch. This is an unusual symptom, but there are many nerves that go from the upper part of the chest, they go to the central nervous system.
Dr. Kitchener immediately orders a CAT scan of Brian's chest, which is more sensitive than the standard x-rays Brian has had. The results are shocking.
He did have a mass in the upper part of his chest, and the initial concern was that it may be a malignancy.
So that was extremely scary. And they ordered a biopsy to see if it was cancerous.
You begin to worry that, hey, am I going to be around here to raise my kids?
2 weeks later, the results of the biopsy are back, and they show no trace of cancer.
So at this point, I was pretty excited that that was not going to be my battle, but I was still wanting to know what it was.
The mass that is shown up on the CAT scan appears to be an abnormally large lymph node. Lymph nodes are the tiny structures in the body that filter out and destroy bacteria and viruses. Although Brian's lymph nodes are cancer-free, the biopsy shows that they contain something very strange: rock-hard calcium deposits.
In his case, it was fairly large, and that meant that he needed to have further studies done.
If they're to find out anything more, the lymph nodes will have to be removed surgically. 2 weeks later, Brian is in the office of thoracic surgeon Dr. Peter Pavlina.
Sometimes in the process of fighting infection, inflammatory processes occur which ultimately lead to the body producing calcium, making the lymph nodes very hard. When I saw Brian and I saw his films, my impression was that these calcified lymph nodes meant that he had a previous infection.
And he told me the only way to really get to these things was a thoracotomy. Basically, they go into your back and spread your ribs apart to go in to your chest. to retrieve these things.
The procedure is extremely risky.
The primary dangers are massive bleeding, which could occur with an inadvertent injury to the heart or to the main pulmonary artery, which is the main artery that supplies blood to the lung.
In April 2005, after living with the symptoms for 9 years, Brian is admitted to the hospital for surgery. He and Amy are terrified.
We arrived at the hospital early in the morning, and my mom was going to meet us at the hospital, but she wasn't there yet. And so I was there by myself. And I just remember that fear of when they took him back there.
The biggest concerns I had were for my wife and for my kids. If something went wrong in surgery, that she would have to raise the kids by herself, and the kids wouldn't have a father.
"41-year-old Brian Sloan is being wheeled into the operating room, where he's about to undergo an extremely risky surgery. At 9 a.m., surgeon Peter Pavlina makes a 6-inch incision in Brian's back, then collapses his right lung in order to get a look at his lymph nodes. What he finds inside is astonishing.
It was pretty messed up. We found a very inflamed, heavily calcified mass located directly on top of his esophagus and compressing part of his heart.
The extent of the damage is staggering. Brian's lymph nodes are almost entirely calcified, like stones sitting in the middle of his chest.
Now, this is a very busy area of the body. The respiratory system has major structures there. The vascular system, the heart, the major blood vessels, and the esophagus is all coming together at this area.
The rock-hard lymph nodes have constricted all the surrounding organs and blood vessels, causing Brian's terrible chest and throat pain. But now Dr. Pavlina can see why Brian was experiencing symptoms in his extremities too.
The lymph nodes were trapping nerves and pressing on them. He felt pains in other locations in his body because that's how his brain perceived the pain.
Dr. Pavlina has done thousands of surgeries, but this one is going to be extremely difficult.
Normally, I can take a forceps and grab that lymph node and pluck it like a grape. But in this situation, it's more like a piece of concrete that is stuck to the heart.
Finally, after 4 hours of painstaking work, Dr. Pavlina and his team are done.
Dr. Pavlina came in and said that everything went really well and that he felt like they had gotten all of the calcification. So at that point, there was a flood of relief.
Meanwhile, the damaged lymph nodes have been sent to the lab to see what could have caused this severe reaction to begin with.
It came back showing nothing really in the lymph nodes, and he thought that the only thing left was histoplasmosis.
Histoplasmosis is a common respiratory infection that has affected up to 50 million Americans. It's caused when fungus spores found in bird and bat droppings are inhaled into the lungs. The symptoms are similar to those of the common cold or flu. Most people recover without even knowing they've been infected. But in a very few cases, patients react abnormally and develop calcified lymph nodes over time.
Brian had a very unusual reaction to a very common disease. Why does it happen in one and not 1,000 other people? We don't know.
After 5 days recovering from the surgery, Brian is well enough to go home.
I noticed right away that when I swallowed, I did not have the sensation in my esophagus.
Brian's myriad symptoms vanish almost overnight. But had the mass not been identified when it was, the results could have been deadly.
According to Dr. Pavlina, the calcified lymph nodes had almost perforated through his esophagus.
The esophagus is here, the trachea is here, the lymph node is here. It erodes both ways, and then eventually there's like a tract. And the biggest danger is recurrent pneumonia.
6 months after his operation, Brian feels better than he has in years. He and Amy are grateful to Dr. Kitchener and Dr. Pavlina for catching and curing his condition. But they still wonder why he had to suffer for 9 years before getting a diagnosis.
Physicians oftentimes don't connect pathology within the center of the chest with pains that seem to be produced outside of the chest.
I feel like I've been given my life back and able to enjoy my kids and do things that I normally wouldn't have had the energy to be able to do it.
The experience has taught Brian, his family, and his doctors a valuable lesson.
You just got to keep pushing on until you get the solution that's right for you and that brings you relief from what it is you're suffering from.
Brian Sloan had a very unusual reaction to a common infection. But when Montessa Pitman first starts feeling pain, it seems like nothing out of the ordinary.
I started noticing that I was having a lot of pain in my joints, and I just started realizing I was having a hard time lifting my arms over my head.
She used to be real flexible. She wasn't flexible any longer. All the joints were starting to act up.
Montessa mentions it to her doctor, but neither is overly concerned because the joint pains always seem to disappear on their own.
It would always just come and go. As soon as I mentioned how bad I was feeling, I wasn't feeling bad anymore. I kind of put it on the back burner.
And for 6 months, it stays on the back burner until the winter of 2003, when the pain starts to spread.
I was getting ready for Christmas, and I had been knitting a lot, and I noticed that it wasn't the normal discomfort. It had moved down into like every joint of my finger, and my fingernails were turning blue.
She didn't have a lot of dexterity in the hands anymore. She couldn't even use the hands like this to stir stuff.
Sometimes it would be like a radiating pain in my bones, almost like I'd have a toothache in my bones. But, you know, everybody has joint pain. Everybody's getting older. And I thought maybe I was just joining the club.
Then, 2 weeks later, during a trip to Washington, D.C., a strange new symptom strikes.
It was really a bitter cold evening, and we walked through the field to see the monuments lit up. And by the time I got home, my eyes were really bright red.
I just figured either she was tired or maybe some makeup got in there. And as the weekend progressed, it didn't go away.
The redness and pain persist for the next 2 weeks. Montessa tries over-the-counter eye drops, but they don't help. Finally, she schedules an appointment with her primary care physician, Dr. Tiffany Lowe.
The first thing that she came to me with was her eye being very irritated.
Dr. Lowe sends Montessa to a specialist. He believes she may be suffering from an allergic reaction and prescribes medicated eye drops. But just as Montessa's eyes begin to improve, her joint pain takes a sudden turn for the worse.
One morning, I had to ask my son to help me to get dressed, just so that I could take him to school. That's when it really hit home that it wasn't going away, it was just getting worse.
For the past few months, Montessa Pitman has been quietly suffering from bouts of crippling joint pain. She's tried to take it in stride, but it seems to be getting worse every day. Finally, she decides to go back to her primary care doctor.
She described it to me as whenever one stopped, the other one would start. And I wanted her to go see a rheumatologist.
You know, he moved the joints a little bit in the hand, did the feet and the legs and the knees. And he says, well, you know, you probably have rheumatoid arthritis.
Rheumatoid arthritis causes chronic inflammation of the joints. Left untreated, it can eventually destroy the bones and joint tissue. But diagnosis can be difficult. About 25% of rheumatoid patients never test positive for the rheumatoid factor in their blood.
He was like, well, you know, you can have rheumatoid arthritis for, you know, a long time before you actually test positive for it.
There is no cure for rheumatoid arthritis, but it can be treated. And the rheumatologist wants to start Montessa on strong anti-inflammatory drugs immediately, drugs that can have some serious side effects.
I didn't feel comfortable with that at all. At that point, I had already decided that I wouldn't be going back.
But Montessa is still in pain, and she knows she needs help badly. Hoping for a drug-free solution, she searches for a new rheumatologist, and 1 month later schedules an appointment with Dr. Carolyn O'Connor.
On physical examination, her joints were not swollen and inflamed. There was no fluid in the joints. And her blood work was negative for the various antibodies that we see in rheumatoid arthritis.
However, there is one unusual finding in her blood work.
A blood test that was abnormal in Montessa was a test referred to as anti-nuclear antibody. It was positive at a significant level, not borderline positive, strongly positive.
Anti-nuclear antibodies, or ANAs, are abnormal antibodies that attack healthy cells. Elevated levels of these antibodies, like the levels found in Montessa, are found in people suffering from a wide range of disorders.
An ANA can be positive in people that have autoimmune thyroid disease, Sjogren's syndrome, rheumatoid arthritis, lupus, or sometimes even malignancies.
While it's a significant finding, a positive ANA level alone doesn't tell Dr. O'Connor what is making Montessa so sick. She must run more tests to see if she can narrow it down, but nothing turns up.
We still weren't sure exactly what was wrong.
And she said, to be honest with you, at this point, I really don't know what you have. And what I'd like to do is keep you under observation. I knew it wasn't the end of it. I just had a gut feeling that, it really was just the tip of the iceberg.
Montessa tries to keep up with her normal routine, but her stiff and painful joints are often preventing her from doing the simplest things.
If she's sitting for quite some time, I would have to help her get out of the chair.
She would fall down. If she was on the ground, I would take her to the couch or the bed, and she would start to cry and stuff.
I'm unable to take care of my son. I'm unable to take care of my husband. I have to be cared for. And this is something that was very foreign to me. I'm the person who's always taking care of everybody. I was an invalid, just that fast.
At her wit's end, Montessa returns to Dr. O'Connor.
When she came back, many of her joints were swollen at that point, and she was incapacitated, really.
She just kind of looked at me like, are you ready to start trying some different stuff now?
Dr. O'Connor puts Montessa on a very low dose of prednisone, a steroid used to treat almost any kind of inflammation. However, after just a few days on the prednisone, Montessa comes down with what seems to be a severe case of the flu.
Montessa was unable to eat, coughing, throwing up.
By the end of the week, Montessa's in terrible shape.
She lost maybe a good 20 pounds. Her clothes, they were sort of hanging on her, so we were getting a little scared at that point.
Her husband eventually persuades her to go back to her primary care doctor to see if she can figure out what's going on.
When I saw Montessa the second time, her fever had actually gone up to 101, and she looked very winded, short of breath, and very tired. My biggest concern was that Montessa was just going to decompensate to the point that she could die.
Terrified, Montessa's family rushes her to the hospital.
She was just emaciated, a skeleton with just the skin hanging there. And it was so heart-wrenching, so painful.
The doctors ordered dozens of tests, and the CAT scan of Montessa's chest and abdomen reveals something unexpected, something that has nothing to do with the flu.
I had fluid around my lungs, fluid around my heart. I had a lesion on my spleen, and also a lesion on my liver. At that point, I became very frightened.
Doctors tell Montessa that these are all signs of lymphatic cancer. Montessa is horrified.
So as soon as they said lymphoma, I'm scared to death because my mother-in-law, passed from lymphoma.
It makes you feel helpless. Let it be me, not my child.
Montessa Pitman is in the hospital fighting for her life. Her doctors suspect she has cancer of the lymph nodes and have ordered a biopsy. Her family waits for 3 agonizing days until finally the results are back.
Doctor came in and she says, well, it's not cancer, but your lymph nodes were bell-shaped. And that's usually linked with patients that have HIV.
My immediate reaction was like, oh, this can't be.
I'm thinking to myself, at this point, how crazy is it that you're like, you know what? Hey, back it up. I'll take the cancer. I'll just go with the cancer. Let's forget all about this AIDS thing. Then once you come out of that craziness, now I'm like, well, hold up, HIV. Now I'm looking over at my husband like, what's all of this about?
She looked at me like, oh, it ain't me. So I'm like, well, it's not me either.
Things were very tense.
The doctors order yet another blood test, and after what seems like the longest week in the Pitmans' lives, they have the results. Montessa has tested negative for HIV.
I was like, oh, okay. Okay, that's good to know. I think I immediately just started welling up.
But the doctors tell Montessa's family that at this point there's nothing more they can do. They send her home with aspirin to reduce her fever and instructions to follow up with her doctors.
I went into a very deep depression. I'm into like the second month of a fever. I was scared that I was going to die.
I started to think, can I raise our son by myself?
A few days after she gets out of the hospital, Montessa has a regularly scheduled appointment with Dr. O'Connor, but she's too sick to go.
I got a note from one of our receptionists that Montessa had been in another hospital not affiliated with where I work.
After hearing Montessa's story, Dr. O'Connor swings into action. She contacts the hospital to obtain Montessa's latest test results, and what she sees stuns her.
She had fluid around her heart, she had fluid in her lungs, she had low white count, she had pain in her legs, and she had a little bit of protein in her urine. She had almost all the clinical features of active lupus.
Lupus is a chronic autoimmune disorder that affects approximately 1.5 million Americans, striking women more often than men. During a flare-up, the immune system becomes hyperactive for unknown reasons. It starts to make antibodies that damage many parts of the human cell. These antibodies circulate throughout the body and attack normal tissue. Left untreated, lupus can lead to a fatal infection or kidney failure. African American women are at the highest risk.
So basically, my immune system started attacking every vital organ in my body.
All of Montessa's symptoms stemmed from lupus: her stiff and painful joints, her inflamed eyes, even the unusual lymph nodes doctors found while she was in the hospital. Dr. O'Connor tells Montessa that she will have lupus for the rest of her life, but she can manage the disease and reduce her chances of having another severe flare-up.
It was very serious, but I had an answer. And I was so confident in Dr. O'Connor that I just knew that it was going to be okay.
As it happens, the treatment for lupus is prednisone, the same drug that Montessa had briefly taken in low doses before she checked into the hospital.
We started high-dose prednisone and a medication called mycophenolate. Both of these medications are effective in treating serious lupus.
Doctors believe that these drugs prevent the immune system from making abnormal antibodies.
I started feeling like myself immediately. So I'm elated. I'm like, whoa, prednisone.
It was like night and day. I mean, she had energy, and she was back to herself.
Had Montessa not been diagnosed and treated when she was, the disease would have continued to wreak terrible and possibly irreversible havoc on her body.
When lupus first presents, it may only involve one organ system, such as the joints. So in those cases, it's very difficult to diagnose. She could have developed more inflammation of her kidney. That would lead to worsening kidney function and even the possibility of kidney failure requiring dialysis.
8 months after her diagnosis, Montessa has not experienced any lupus flare-ups.
I think Montessa will do fabulously well as long as she stays on her medications and she's monitored for signs and symptoms of lupus.
Montessa will have to see a rheumatologist regularly for the rest of her life, but she's feeling great and thankful for the lessons she's learned.
Trust in the people that you've chosen to help take care of you, and tell them everything, no matter how embarrassing or how minute or insignificant you might think it is. Make mention of it.